part is all about getting to know your body just a little bit more. I really believe that knowledge is power and that this part of the course will be invaluable for the rest of the program. I have learned over the years of teaching pelvic floor tune-up programs to a variety of women is that they're more willing to implement the suggested strategies, changes in lifestyle, the massages, the exercise, and everything that I have to suggest if they understand why. And there's a greater rate of compliance if you actually can relate it to you personally, how it affects you. So if you're willing to implement and you're willing to put it to the test and really work it, your rate of success is going to be greater. So understanding your body helps you take charge and be able to take control and get rid of the embarrassing or painful moments. Totally worth it. Now, this program, or my program, is all about understanding how the entire body and mind has an effect or have an effect on the proper functioning of the pelvic floor and vice versa. So I'm going to highly recommend that you don't skim through this part because it's anatomy, but I also recommend that you don't use this as a training tool or a study guide to be able to pass an exam for anatomy at school. It's going to be simplified. I am going to talk about landmarks and bones and muscles and fascia and tissue and all this stuff, but I'm going to do it in a way that is simple enough. I'll use layman terms too. And I'm hoping that it's going to be super impactful, just like I've had the results from the feedback from some clients going, wow, the anatomy part was amazing. I had that aha moment of understanding. You're saying that this is connected to that, so that's why I'm struggling with this. Yeah, there's some aha moments and it's really great. So I'm hoping you do have that, and it's possible that this part of the course will be the most influential part for you. And I bet you, and I'm pretty sure after taking this part, you're going to have richer conversations with your general practitioner or any professional that you're going to hire to help you along your journey to take control of your body and get rid of those awkward, embarrassing, and painful moments. So, Anatomy 101, ladies, anatomy of your lady parts and beyond. We are going to start with the pelvis. We're going to talk about all those landmarks and muscles. I'm going to show you a visual before we get into the images that are going to be throughout this video, just to give you an idea of what we're looking at. We're looking at your pelvis. Now, this is your pelvis seen through an x-ray, and you'd be looking, at yourself in a mirror. Now, I'm going to place it where it would be on the body. That's the view from the front. And then we're going to look down inside. So if you look down your body, you see this is your pelvic floor, and we'll talk about that. That's the lowest part of your body. Now, I'm also going to show you from behind, so you're going to get to know some of the landmarks. And then I'm going to show you from behind, tipped over this way. So I'll give you a visual, and please excuse my buttocks, but you're going to take a look at, this is how it's going to be. Yeah, I apologize for that visual, but you'll see some other stuff throughout the class that you're going to get a good kick out of.
Here's your pelvis. You have a right side and a left side. You actually have two bones, right pelvic bone and left pelvic bone. On this image, you see parts of the spine. You only see the end of the lumbar spine, then you see the sacrum, and then the tailbone way at the bottom of the back there. Now shift your attention to where the two pelvic bones connect at the front of the body. That's called the pubic symphysis. You might not know the names of these bony landmarks, but you know them because when you sit, you feel you have a bony butt. That's the ischial tuberosity, or commonly known as sits bones. Here's a landmark you can easily touch. When you put your hands on your hips, you're touching your iliac crest. And then, if you look at the front of your pelvis, there's a relatively pointy edge, and that's called the anterior superior iliac spine. From this point on, we'll call it the ASIS. It's going to be a landmark that I'm going to use when I guide you through massages and some exercises. I'll show you the landmarks for the back of the pelvis in a little while. Let's just continue looking at the pelvis from the front, but this time tip it over, take out everything inside your pelvis, and this is what you would see. Your pelvic floor muscles, at least the ones that you can see from this angle. All right, you can notice white lines, thick lines. Those would be ligaments and fascia. And then you see some, what looks like individual muscles, and they've got kind of striations in them. And those striations show what their line of pull during contraction would be. Now let's look at these muscles individually. Before we dive into the muscles, I want to make sure you're well oriented. That yellow dot is the symphysis pubis at the front of your pelvis. Outlined in yellow is your spine and your tailbone. This is where you can rest your hands on your hips. The pointy edge at the front of your pelvis is your ASIS, and the squiggly yellow lines is the inside view of your sacroiliac joint, where the sacrum and the pelvic bones connect. On to the muscles. This part of your pelvic floor is the first layer of the lowest part of your core, that layer of pelvic floor muscles that's most intimately in contact with your pelvic organs, vessels, fascia, tissue, nerves, everything that can be at the bottom of your pelvic bowl. So we're going to look at the 6 major muscle groups that make up this pelvic diaphragm. I'd like to introduce you to the levator ani. It's a group of 3 to 4 muscles that work as a team. Now let's look at them one by one. The muscles that I've painted in blue are the puborectalis and the pubovaginalis, very often considered just one muscle, and it slings from the pubic area all the way around those white openings and back, so it has a sling effect. Now the spaces, those white spaces, are at front the space for your urethra and your vagina, and further back, well, that's for your rectum. The puborectalis is basically your key muscle when you poo, so when you eliminate. Now, depending on the position you take to do that, that puborectalis will be at different angles, and certain angles are more efficient to making sure that you can evacuate everything that you need to evacuate. Levator ani team member number 2, the pubococcygeus. Pubo as in pubis, coccygeus as in coccyx or tailbone. So it attaches at the front and at the back. Now the line of pull will be one towards each other, meaning the tailbone and the pubis will pull towards the center, towards each other. Now if this muscle is over tight or too weak, there's going to be some problems. Here's a third muscle that's part of the levator ani group. It's called the iliococcygeus muscle. Now notice, its line of pull is different than the first 2 muscles that's part of this group. This one pulls in, so imagine your sits bones or your ischial tuberosities being drawn into the center line. And also it has an uplifting pull. An interesting muscle group. On to a different pelvic floor muscle. It's highlighted in pink. It's called the coccygeus. And as you'll notice, it has its own particular line of pull. Now, you're noticing, there's different muscles, different lines of pulls, so there's different responsibilities for each of these muscles. They have to work well as part of the team. If one's not working well, the rest of the team won't work well. What you see painted in yellow here is a muscle that lines the pelvic bowl. It snuggles up against the inside of the bone at the front and the lowest part, and its name is the obturator internus. And there's some really interesting facts about this muscle. If its tone or its ability to contract thoroughly and relax thoroughly is compromised, if this muscle is inflamed, or if it has some trigger points, it can create some pretty funky referral patterns throughout your body. I'm going to list a few painful conditions that you may have struggled with or you may be still struggling with. I want you to understand that there could be a whole bunch of reasons for what you're going through. But if you've been, seeking massage therapy, chiropractic, physiotherapy, or osteopathy, you've tried it all and it just won't go away, I want you to keep this little muscle, the obturator internus, in mind. All right, so if you present with coccydynia, which is pain at the tailbone, piriformis syndrome, which is pain across your buttocks, if you present with low back pain, or sciatica, sciatic is a nerve pain, SI joint pain, or bursitis, where the thigh bone connects to the hip bone. Yeah, it's funny, huh? That little muscle could potentially be the starting point, that root problem that you need to go and address. Here's the other muscle that lines the bottom of the pelvis at the back. It's called the piriformis. Both the piriformis and the obturator look like they're just inside and that's it. But when we're going to turn this over and look from behind, you'll see that they come out behind the pelvis as well. Now there you go. You know the 6 major muscles that are part of your pelvic diaphragm, that part of the pelvic floor that is the most intimately connected to the pelvic organs. All right, let's get to know a few more pelvic floor muscles. And the way that we're going to look at it today is from behind and below. You remember the visual I gave you when I leaned over? Well, we're going to look at it from this angle. Of course, it's not as simple as bend over and voila, you can see all of these muscles. Some of them are very much covered by other muscles, or definitely by fascia and fatty tissue and skin. Once again, I want to make sure you're well oriented. That yellow dot is the pubic symphysis. The spine is highlighted in yellow, and take a look at how the tailbone is definitely held there by some muscles. Just as the front of the pelvis has a relatively pointy landmark, the back of your pelvis does too. And we're going to refer it as the PSIS, the posterior superior iliac spine. It's really not clear on this illustration, but this is where your sacrum and your pelvis would connect, creating the SI joint that you would be able to palpate exteriorly from behind. On this model, you find the ischial tuberosities or sits bones right here. There are 2 other layers of pelvic floor muscles that we're going to get to learn, but first I'm going to bring you back to the pelvic floor diaphragm muscles that we saw from the inside, those that we can actually see again here from the back, from the outside. There are 2 of the levator ani muscles that you'll be able to see from this angle. You've got the iliococcygeus as well as the puborectalis. Notice the relationship that they have with the tailbone and the rectum. The name levator ani actually says it's levator or lifter ani, lifter of the anus. The levator ani muscles, the ones you see and the ones you don't see, have a pulling in and up effect, in addition to a sling effect that's going to help the sphincters that we're going to talk about in a moment. These levator ani muscles are not covered up with a whole lot of other muscles, so you can actually feel them, you can palpate them yourself. If you place your hand and you feel your tailbone and your rectum and feel until you hit the pelvic bones, you're actually touching the levator ani muscles that we're going to work with throughout this program. On to another pelvic floor diaphragm muscle, seen here in pink, the coccygeus, which definitely has effect on the coccyx, on the tailbone. You can also palpate that one fairly easily from this angle. The other 2 muscles that we saw from the inside are the obturator internus, as seen in yellow, and the piriformis muscle, as seen in green. So the 2 muscles that line the walls of the inside of the pelvis, they come out and then go along the outside back or posteriorly to go and attach to the thigh bones. Unlike the levator ani muscles and the coccygeus, these two muscles are not as easily accessed. You can't feel them as easily because they're covered up with a whole bunch of muscles. They're covered up with your glute muscles, your bum muscles. On to the next layer of pelvic floor muscles, we find sphincters. Now, as females, we have three openings. We have the rectum, we have the vagina, and we have the urethra. So we have compressors for all three areas. We have a rectal sphincter, we have the urethral vaginal. So in red, you see that it goes around the vagina as well as the urethra. And then we have the urethral compressor. Now, if you're incontinent, you're going, oh, wow, these are the muscles I need to take care of. Well, yes and no. Definitely we need these muscles to work well. We need the central nervous system to work properly to help these sphincters react when they need to react, but they're not the end all be all. They need to work with the rest of your team. So keep that in mind. The next layer is an intricate mix of fascia and muscle that span across the front of your underside, basically at the front between your legs before your anus. It has a triangular shape, as you can see here in yellow. Your external genitalia attaches onto this surface. Muscle-wise, you have the deep transverse perineal muscle that goes from your pelvic bone and attaches to the center point between the vagina and the rectum. Then there are muscles that sling around your vagina and your urethra. So these muscles do work to keep us continent and also capable of pleasurable sensations. Once again, don't get stuck on the idea that, okay, these must be the muscles we need to fix for incontinence. Again, they're part of a team. Well, congratulations, you know a whole lot more about your pelvic floor. Now we're going to go on to the next part. I'm going to talk about what's inside, what that pelvic floor is holding up, or make sure that it doesn't fall out. Let's get oriented. This is a view from the side. Here's your pubic bone, your coccyx, your pelvic floor. Now look at your bladder, your uterus, your fallopian tubes and ovaries. Here's your cervix, your rectum and bowels, and of course your urethra, vagina, and anus. Well, those are a lot of things to try and keep from falling out. So your pelvic floor muscles have a huge job. Now, they're not only influenced by what you see in this image, there's stuff that you don't see. There's the intestines and everything that's in your abdominal cavity. Now, if there's anything that increases the intra-abdominal pressure, pushing down on all of these organs and pushing onto the pelvic floor, there's going to be some challenges, and eventually your pelvic floor muscles might not be able to support as well as they should. So we're going to learn all about what can create too much pressure, an amount of pressure that is beyond the capability of the pelvic floor muscles. Constant pressure or repetitive high pressure states that can lead to an overburden and weakening and actually failing of these pelvic floor muscles to do what they need to do. I'm going to talk about this topic in depth throughout the entire program at a whole bunch of different times. But right now, we're going to stick to anatomy and looking at some more muscles. And the muscles that are above and below our whole pelvic area. Muscles that are going to have a huge impact, huge effect on how well our pelvic floor can function. So we're going to start off with looking at these amazing muscles. You're looking at a person from the front, basically through an X-ray machine, and then a couple of muscles have been drawn in. The two muscles I want you to focus in on are the diaphragm and the psoas muscle. Let's take a good look at that diaphragm. Your lungs and heart are inside that rib cage, leaning on top of that dome-shaped muscle. The edge of the base of the diaphragm connects to the base of the ribs on the inside and goes all the way around from front to back. Look at these tentacle-like extensions. That's how the diaphragm attaches to the spine. It attaches at the front and slightly to the side. These tentacle-like extensions are called the crura. I have no doubt you're wondering why I'm talking about a muscle that's so far away from the pelvic floor. Well, the diaphragm and the pelvic floor are so interconnected. It's phenomenal. When the diaphragm moves during breath, the pelvic floor moves. When the diaphragm is restricted because of so many different reasons, because of poor breathing patterns, because of poor posture restricting breath, there's an effect on the pelvic floor. It ends up creating a strain. So we want to make sure that we breathe properly. And we're going to go into that in depth later on in the program. As I go into talking about different muscles that might have an effect on the pelvic floor, I want you to remember that little jingle, the foot bone's connected to the shin bone's connected to the whatever, that little jingle. Well, know that everything is interconnected. And it could be that, certain muscles will have a definite effect on the pelvic floor, and others it'll be so indirect that you're wondering why I even mention it. But the indirect link can have a huge effect if there's a snowball effect. If you're looking at more than 1, 2, 3, 4, 5 muscles not working well, that can lead to a breakdown in the system, and your breakdown in the system could end up leading to basically your incontinence or your pain during intercourse or any other of the problems that you might have with your pelvis and pelvic floor. So hang in there. I know a lot of details, but it'll make sense as we go along with the program. Now I'm going to bring your attention to a muscle called the psoas muscle. It's that long wavy muscle that you can see. Look how it starts up, way up underneath the diaphragm, underneath the crura. So it attaches to the last of the thoracic vertebrae, the T12, along the side, and it goes down the lumbar spine, the L1, 2, 3, and 4. Now it waves along and comes up and over the pelvic ridge there and attaches to the femur. Now along the way, it kind of links up with the muscle that is coming from the inside of the top part of the pelvis, and that one's called the iliacus, and both together are called the iliopsoas muscle, and together they are a powerful flexor of the thigh. I'm going to talk at length about these muscles throughout the program because of their intimate connection to the diaphragm, and I said the diaphragm has a huge effect on the pelvic floor, as well as the connection to the pelvis and the movement of the thigh, just the overall movement in the body. This muscle, if it's not doing well, if it's shortened because you sit too long, if it's tense because you hold your tension there, and so many other things I'll go into, can have such a huge effect on the quality of how our pelvic floor can work. Now there's a lot to look at. Please don't worry about the names of the muscles. It really doesn't matter. We will go over them during the course. But what I want you to see is some specific things that I want you to take notice of. Let's look at the image on the left. Look at the span of muscles that go from that thigh bone and all gather up and connect at the ischial tuberosity area, close to that symphysis pubis. These are muscles called adductors. Adducting means adding. When you bring both legs together, you're using your inner thigh muscles to pull them together. On the right side of the screen, you have the front of your thigh, usually called the quads. There's 4 muscles that span the entire thigh bone and attach to the pelvis. Now they snuggle up pretty darn close to the psoas muscle, so they do have an effect on each other. Now just below those quads, you can see the image of the hamstrings that would be behind your thighs, and we're going to look at it from the other side, from the back side in a moment. But again, I want you to take notice of where they attach. Look at where the ischial tuberosity or sits bones would be. Again, very close to the pubic symphysis. Very interesting connection, how those can affect potentially your pelvic floor. Onto our backside. Our bum, our buttocks, our butt, our gluteus, it doesn't matter what you want to call them. It is the beautiful package that is behind there. Now there's a whole bunch of different muscles, and please don't get overwhelmed with the names. I want you to see some landmarking that could help you understand why we're going to massage or exercise certain muscles. Before we get talking about the bum muscles, I also have to talk about the hamstrings that I mentioned earlier. I said we'd look at from behind. We don't have a great view here, but you can see that the muscles that come up the back of the thigh snuggle underneath the gluteus maximus, and you can't see the attachment here, but they do attach to the ischial tuberosity. So the hamstrings are a little bit more difficult to get to at that level, at the attachment, because of the big glute muscle that's on top of it. All right, gluteus maximus, biggest muscle that you can feel when you touch your bum back there. Peel that away and you would expose the gluteus medius that's underneath it. But if you notice in this drawing, the gluteus medius is also further up the line, which is not covered by the glute max. Take those two muscles away, the medius and the maximus, and you expose the gluteus minimus, which is the muscle that lines that pelvic bone posteriorly on the outside. All right, as we exposed, took away the max and the medius, we've exposed other muscles like the piriformis. And we saw the piriformis earlier. And you can see that it attaches to the thigh bone and it goes towards the sacrum, goes into all of the fascia and ligaments and goes, well, you can't see it from this angle, but goes onto the inside. And you know that because you saw that earlier. You've got other muscles, don't worry about their names. You've got the gemelles and you've got the quadratus femoris. You also have the obturator externus, which is a little different than the obturator internus. Don't worry about the names, just know that they're little muscles. They can be tender if you poke at them, but look at their relationship to the sacrum, to the ischial tuberosity, to the pelvis. They definitely can have an effect on the proper functioning of the pelvic floor. My brief talk on anatomy wouldn't be complete if I didn't talk about the core. What you see here is the side view of a person's midsection. Let's quickly get oriented here. You've got the pubic bone, the tailbone, the sacrum, the spine, and that's your back. You've got the abdominal region, and you've got the lower part of the ribs. Let's look at the muscles that make up the core. The first one way at the top is your diaphragm. Yeah, that breathing muscle, that's the top of your core. Now the bottom of your core, you guessed it, it's your pelvic floor. Now the back part of your core are muscles that go along your spine and they're called the multifidus. And then the front, well, the entire girdle-like muscle, the transverse abdominis, that one actually goes from one side of the spine, wraps around the front, and goes and attaches to the other side of the spine, like this big old elastic band or girdle. Muscles are not just made up of muscle fibers. There's also fascia, connective tissue. Now, if you look at the transversus abdominis, you notice that there's a lot of fascial tissue. It's that white span here. Now, that's an important feature to remember, especially if you're somebody who is struggling with something called diastasis recti. That means there's a weakening of that fascial tissue. And that fascial tissue spans a good chunk of the front of your abdomen. There could be a splitting at the front, or as you contract when you brace, you might have a pooching of your belly. We're going to get into that in detail as we get into the exercises and massages. The muscles of the core create an enclosed space that I'm going to call a canister. In that enclosed space, in that canister, there is pressure, and I'm going to call it intra-abdominal pressure. That intra-abdominal pressure can increase or decrease depending on what we do. Since the pelvic floor is part of this team, and since we want to make sure that the pelvic floor is not negatively affected by this pressure, I'm going to teach you all about preparacore bracing, and I'll also go through all the things that we do, lifestyle habits, that might increase that intra-abdominal pressure and overburden the pelvic floor. Wow, I threw a lot of information at you about anatomy in less than 30 minutes. The goal wasn't to overwhelm you or insist that you need to know everything about your anatomy to be able to get rid of your struggles with incontinence and pain. I just want to give you enough information to help you understand why I'm going to encourage you to make some significant and possibly counterintuitive changes in your posture, your lifestyle habits, your movement patterning, exercise and massage, and everything else that we're going to talk about during this program. On we go to the next video. It's going to be all about the 5 functions of the pelvic floor. Yes, a little bit more anatomy, but some applicable things that you can actually put into practice immediately.